Hello and welcome to a special edition of Good Day Extra. It's our Senior Living Showcase. I'm Cameron Fontana.
And I'm Elisa Henry. Thank you so much for joining us today. You know, after a lifetime of hard work, retirement offers seniors the chance to enjoy the fruits of their labor with more time for relaxation, hobbies, and spending quality moments with loved ones.
You know, seniors have spent years contributing to our neighborhoods and now deserve the best care and support in their golden years to live independently, stay active, and enjoy their daily lives with dignity.
Which is why local businesses play a vital role in enhancing this next chapter by offering services that cater specifically to the needs of Central Ohio's seniors.
From healthcare, Medicare, and wellness programs to convenient meal delivery options and white glove transportation services, we're going to shine a spotlight on businesses that provide the support and resources that make retirement both more enjoyable and stress-free.
With the right services in place, seniors can truly make the most of their golden years. Let's take a look. This segment is sponsored by Ortho Neuro. If you're dealing with hip or knee pain, this segment is for you. We're here at Ortho Neuro in Westerville to talk about early diagnosis, lifestyle changes, preventative things that you can do to help with that pain. Joining me now is Dr. Michael Canone. Thank you so much for having me here today.
Thank you.
So we're talking about hip and knee arthritis. What exactly is it and how does it affect a patient's daily life?
So the primary, hip and knee arthritis is wearing out of the joints. The articular cartilage, which is the covering of the joints, starts to degrade and fissure and break off and gets down to bone and on bone, and that's when we call it arthritis. But it's a process in osteoarthritis that happens over a prolonged period of time.
And so what are the most common symptoms of hip and knee arthritis, and then when should someone seek medical advice?
So the most common symptom of hip and knee arthritis is pain. Pain associated with activity, pain affecting your function. And when it starts to limit your ability to do things, then you definitely need to seek attention. Things that you can maybe alter in your everyday activities. Better to put off any type of surgical procedure.
I think there are people who definitely want to put off surgery as long as possible. What are some of the latest advancements in treatment?
So advancements in non-surgical treatment, there's a lot going on biologically. The unfortunate thing is what's going on biologically isn't always covered by insurance companies. So it ends up being a cash out-of-pocket expense for patients when you're talking about things like PRP, which is when they take blood out of your arm, spin it down, get the platelet-rich concentrate out of that to inject it back into the joint to diminish some of the pain symptoms and things like that. It's used a lot in knee arthritis. Okay. Also stem cells and things of that nature are newer advances. The problem is also we really don't know what the long-term effect of these are going to be at this point in time. Gel injections have been around for at least 20 or more years.
And many patients do worry about getting surgery. So at what point do you recommend surgery? And what are the potential outcomes of a procedure like a joint replacement? That's a huge surgery.
So joint replacement surgery, the outcomes are excellent at this point in time.
Okay.
Time to consider doing it is the patient's decision.
Okay.
I personally let them decide when they're ready. They're the ones going through it, so they need to decide when they're ready to do it for the best outcome. When we used to have a lot of activity at malls and things like that, I would tell patients, when you make a decision, hey, I'm not going Christmas shopping at the mall this year because by the time I get out of the car and get inside and walk around and maybe get to a store or two, I'm looking for somewhere to sit down. That's the time that, it's telling you you should consider doing something more. And you failed all non-surgical treatment.
Okay, so there are things they can do before, but once they get to that point, it really is their decision. What role does early diagnosis and intervention play in preventing the progression of hip and knee arthritis, and what steps can patients take to protect their joints?
So the first and foremost thing that patients can do is keep their body weight down. An early diagnosis can then sometimes, in that case, help prolong the joint. Staying active is very important. The more sedentary patients become with arthritic joints, the more symptomatic they'll become. If they're having pain and they have had conservative treatment, their primary care doctor has prescribed anti-inflammatories for them, physical therapy, things like that, they're still hurting, that would be the time to come in. Or if they're just not satisfied with where they're at, they can come in. We can talk about the different treatment options that they may be interested in.
Well, Doctor, thank you so much for having us here today. It's a pleasure talking to you and learning more about what you can do to help people with hip and knee pain.
Thank you. Thank you.
This segment is sponsored by Country Club Rehabilitation Campuses and Monarch Skilled Nursing and Rehab. Country Club Rehabilitation Campuses and Monarch Skilled Nursing and Rehab are leading healthcare facilities dedicated to providing compassionate, high-quality care for individuals recovering from illness, surgery, or injury. Here to tell us more is Ashley Fisher. Thank you so much for being here with us today.
Thank you for having me today.
So tell us a little bit about Country Club Rehabilitation Campuses and Monarch Skilled Nursing and Rehab.
So our company has been in business for over 50 years.
Wow.
We are proud to say that we are an Ohio-owned and operated. We also locally source our care right here in the Buckeye State. And that was something that was very important to our founder, was that he wanted to provide care in his own backyard.
Yeah.
And so although he's been retired for quite some time, our current CEO, who has been with us for 22 years, has carried on his vision. One thing about our campuses is that we do have 7.
Okay.
In Ohio. 6 out of the 7 are what we call CCRCs, and that's full continuum care.
Okay.
And what that also means is that we provide everything under one roof, basically. So everything from skilled rehabilitation nursing, short-term, long-term care, and independent and assisted living. And the one nice thing about that is that as your loved ones transition through different stages of life, we can help with that transition a little bit easier.
Nice, there for all the stages.
Right.
Yeah.
And I feel like sometimes people get the misconception that nursing homes are only for elderly care, and that's not the case.
Okay.
For instance, with our skilled nursing and rehab, our goal is to get you back home. We want to get you back to 100%, back into your home, back into your community, and the things that you like to do.
Okay.
We welcome all ages that could use our services. We actually have someone that's been with us for quite a few years in Delaware. She's only 40, and she's basically completely healed, and we'll get to spend Christmas with her family. So that's a really amazing story to share.
Yeah, that is fantastic.
Yeah.
So what sets your company and its campuses apart from others in the industry?
So like I mentioned, we are Ohio owned and operated. And with that being said, that also means that our staff is local to the facilities as well. So you're going to see our corporate leaders, our department heads, and other staff members out in your communities.
So expand a little bit more on some of the features that you have for the people who take advantage of your company.
So one thing, like I said, we are CCRCs with the exception of Delaware. And several also offer pulmonary and respiratory care. Delaware is one of them. And so if you are on a ventilator, we can also help with that. We have a pulmonologist that does weekly rounds. We offer 7-day-a-week rehab therapies. All of our nurses are certified wound care specialists. And a few of the fun things is, for instance, at Monarch, we have a putting green, movie theater, barber shop, things along those lines. And it's important that we want them to feel at home.
Yeah. So what are things that people should consider when they're searching for a facility for themselves or for their loved one?
So the first thing is location. You want to be close to your home, close to your loved ones. The very important thing is to do tours and take that time. When I do tours with families, I want to build that connection with them. I want to know more about them, more about their families, because this is their new home. And so if that means that, you know, there's something special they like to eat, I want to make sure that we can provide that for them. If there's different activities they like to do, is there natural lighting? Does it smell good in there? There's a lot of things that take into consideration when you're picking this, because this can be a very stressful situation, and we want to be able to make this as comfortable as possible for the families.
Where can our viewers go for more information?
We do have social media pages, and you can also go to our website.
Perfect. Ashley, thank you so much for being here with us today. Really enjoyed hearing what you have to offer. Thank you so much. This segment is sponsored by Simply Easy. Simply Easy Food Delivery is a convenient and hassle-free service that brings your favorite meals right to your doorstep. Here to tell us more is Dan Val. So first, tell me a little bit about Simply Easy.
So Simply Easy was founded 27 years ago in Mansfield, Ohio.
Wow.
Started out as a small route of helping seniors with meals, and has now grown into covering the whole state of Ohio and southern Michigan.
That is fantastic. So you got some examples of the meals here. Tell us what we're looking at. Like, tell us about these meals right here.
Yeah, so what you see here is our tray menu option. So all our food is either comes in a tray, or we also have vacuum sealed individual items. Everything is curated by a dietitian, follows state guidelines for nutritionals, but we give you two options. So this obviously is something that if you just wanted to pop it in the microwave or oven, you could use. This gives you the option of mixing and matching entrees with different vegetables and fruit.
Okay, and in addition to the entrees, the different sides, you also offer other things.
Yes, so we have semi-vegetarian meals. Our meals come complete. So what you get in a weekly delivery would be milk, you get your bread slices,
Nice.
you get 4 pieces of fresh fruit every week, and then also juices to supplement the fruit option also.
That is fantastic. Everything that you need. So typically, who do you serve?
We serve primarily people 60 and over.
Okay.
And we cover the whole state of Ohio, like I said, so we have offices in Akron, Toledo, and then Columbus.
Okay, great. So anyone who's that age group, when I'm looking at this food, like, this sounds like it'd be good for me or even for my 7-year-old too.
Yeah, absolutely. I mean, we also have private pay, so anybody can order this food.
Okay.
What we really focus on is the senior population,
Yeah.
the most in need. If you look at survey data indicates by the year 2030, there's going to be over 3 million people in the state of Ohio that are over the age of 60.
Wow.
So that's 25%, that will be 25% of the population. So there's obviously a need for nutrition with
Yeah.
that age group, along with everything else that they need.
Absolutely. And so how does someone benefit from your meals?
So the benefit is, for that population, our services provide them an opportunity to stay at home where they want to be. Instead of having to go out for food and looking for food in other places, they can stay at home, live their life at home where they want to be, and then get the proper nutrition at the same time.
That is so fantastic. So do you order for the week, for the month, for the day?
Yeah, most people order for a week or a bi-weekly.
Okay.
So they get once a week, like I said, they get the same driver comes at the same time, same day every week.
Nice.
And either gives them 5 meals or 7+ meals in
Okay.
terms of what they would get. So we offer lunch, dinner options, breakfast, semi-vegetarian. So in that weekly delivery, they get enough lunch and dinner options for 7 days.
That's fantastic. And having that same driver, you kind of develop a relationship with that driver also.
Absolutely. A lot
Yeah.
of people have known people for over 10 years in terms of the driver and the client relationship.
I love that. Great relationship and great food. How can our viewers sign up?
SimplyEasy.com basically is where you
Perfect.
go. Our website has a zip code locator, so all you do is punch in your zip code. It takes you to the correct office and gives you the phone number and information you need.
Thank you so much, Dan, for joining us today.
You're welcome. Thank you.
So great to see how you guys provide these delicious meals. For more information, you can visit their website.
This segment is sponsored by Advantage MedSup Medicare Plans. Advantage MedSup Medicare Plans is dedicated to helping you navigate the world of Medicare and give you confidence and ease through the entire process. So here to tell us more, joining us in studio, is Gina Giambri. Gina, it's so nice to meet you.
Nice to meet you.
I love this because your team is not just a new kid on the block. Talk about how you're 3 generations and how that grows the trust with your customers.
Absolutely. So having 3 generations means you know we're going to be here. We're here now, and we're going to be here in the future, and we have plenty of agents to help navigate the complex world of Medicare.
So why should someone choose a local agent versus the 800 numbers we see all day on commercials or even other options out there?
I think the direct communication is key because you don't get, there's no endless button pushing, no automated menus. You're not screaming into the phone, representative, or speak to someone.
I've been there.
Right? You're just, when you call us, you get to speak to someone, you get a direct agent, and we're local.
And I've been there. You hit the nail on the head. I mean, they even got smarter to where you can't just keep pressing 0 anymore because it'll just
Right.
hang up on you.
Right.
And there's a big difference because I want to make sure I get this right. Medicare Advantage and Medigap. What are those? How are they different?
So Medicare Advantage is a pay-as-you-go, and Medicare Supplement is managed monthly with a monthly premium.
Okay.
So with the Medigap or the Medicare Supplement, you make a monthly premium, you have a small deductible that Medicare sets, and you pick up a standalone drug plan. With the Advantage plans, those are pay-as-you-go. If you don't go, you don't pay. But instead of paying the monthly premium, you pay for services as you use them.
So with tons of options out there for people watching, how do they make sure they choose the right plan that works for them?
Well, you really have to consider your budget,
Okay.
your health needs, and how you feel about money. Because Medicare is not free. It's an 80-20 plan. So you're going to pay, your choice is how and when.
And what are the first steps people need to take? For people watching right now, we're in annual enrollment. It's a big decision time. What do they need to do? What can they expect in order to reach out to your team and start?
Well, they can contact us at advantagemedsup.com, call our office, or book on the website. They can meet with us face-to-face. They can Zoom. We have an office in Westerville. We have agents that will meet you at different locations. Some do home visits.
Wow.
Yeah, so we're local and we're available.
The fact that you do home visits and people can visit you in person, I don't even like to buy a big purchase online. When I can see someone, I can imagine people are just more confident in their choice, right?
Yes, and that's the beauty of it. You really get to know the local people in your community, and they feel good about their choices, and they're confident when you straighten it out for them, and it really helps having a local person that you can visit year after year. There's no need to start over every time you want a plan review.
3 generations, a real person to help you through what can be a really stressful process. Gina, thank you so much for sharing this with our viewers
Thank
today.
you.
Like she said, if you want to reach out to their team, the website is right there on your screen, advantagemedsup.com.
This segment is sponsored by Hearing Health Solutions from Ohio ENT and Allergy Physicians. Hearing is one of our most vital senses, and if you are experiencing hearing loss, then the specialists here at Hearing Health Solutions are here to help. Joining me, doctors of audiology, Kara Schneider and Colleen O'Malley-Marlene. Thanks so much for being here with us today.
Of course, thanks for having us.
So first, let's talk about the symptoms. Like, how does someone know they're experiencing hearing loss?
So hearing loss is often a gradual and progressive deterioration of our hearing over time. So you might notice trouble understanding speech clearly, whether on TV, in person-to-person interactions, or in group environments where background noise is present.
And how does hearing loss affect or negatively affect someone's day-to-day, their quality of life?
Yeah, there's a lot of different ways that hearing loss can affect your day-to-day. So often people are noticing they're having more difficulty communicating with their family, their friends. It can lead to more strained relationships as their loved ones are getting frustrated with them, that they're often having to ask for repetition or they're misunderstanding what's said, so it can affect your social life. And along with that, people notice that they're maybe not going to their favorite restaurants anymore because there's so much noise present and there's multiple people speaking that they just can't keep up with the conversation. So they often start to withdraw or socially isolate, and that can really impact your overall health in a negative way.
Absolutely. And is there help? What kind of treatment can be done for someone that's experiencing standard hearing loss?
Absolutely. If someone's experiencing a hearing concern, they can come and meet with one of our licensed audiologists where we can do a full diagnostic evaluation of their hearing in both ears and any other symptoms they're having related to their ears. If they are a candidate for hearing aids, we offer the options of what kinds of hearing aids or other assistive devices are available, whether those are prescriptive hearing aids managed by our audiologists or over-the-counter hearing devices and assistive devices.
And there might be some people who are watching who are thinking, you know, this sounds like me, what you're saying sounds like me. So what are the benefits of getting treatment early?
Yeah, tons of benefits. Like I said, you know, better relationships with your family. The sooner that you treat your hearing loss, the better you're able to get used to hearing aids. So when your brain goes so long without hearing and getting stimulation at certain pitches where there's hearing loss, those kind of hearing nerve connections in the brain start to weaken, and then when people eventually do get hearing aids, their brain has a hard time getting used to them. So the sooner that you treat your hearing loss, the more comfortable and natural those hearing aids are going to sound to you. And overall, again, just helping your quality of life, as hearing loss, and I had touched on that kind of social isolation or withdrawal factor, can increase your risk of cognitive decline over time.
And for those who aren't experiencing hearing loss right now, is there a benefit, is there a reason to start monitoring your hearing, and how can someone do that?
Absolutely. So we recommend starting with hearing screenings around age 50.
Okay.
So even if you're not having any hearing concerns yet, it's really helpful to establish a baseline hearing evaluation so that if you do experience progressive decline in hearing, we can stay on top of that, monitor that, and know when it is time to recommend a hearing solution.
When should they come see you?
As soon as you or a family member or a loved one is noticing any difficulty with hearing or understanding conversations, you can visit our website at hearinghealthsolutions.com, and we have 6 locations around the Central Ohio area to help.
So Dr. Schneider, thanks so much for having us today. Dr. O'Malley, Marlene, thanks so much for having us. It's so great to hear what you guys can do to help people keep that vital sense of hearing. Thank you so much.
Thank you.
And as they said, for more information, you can visit hearinghealthsolutions.com.
This segment is sponsored by Compassionate Caregivers Home Care. With the right support, seniors can live both happily and safely in their own homes, and that's exactly what the team provides here at Compassionate Caregivers Home Care. Joining us now, we have the owner and registered nurse, Miss Debbie DeLuca-Ely. Nice to meet you,
So
Debbie.
nice to meet you too, Cameron.
So right off the bat, what sets what your team does apart from the other home care providers out there?
Well, I think as a company, when I started this company, I wanted to have a company that was clinician-based. And we have 3 registered nurses on staff, and the nurses are the ones that go out and meet the clients in their homes or in the facilities, and we do all the assessments. And so that in itself, I think, is very different from the other non-medical home cares. You know what else sets us apart, Cameron, is as of today, we are Central Ohio's only ACHC accredited non-medical home care. Plus, I have the pleasure of having my family work with me, because as a child, I watched my mom care for my grandmother. Little did I know today I would be one caring for other families, and it's a blessing because as a family-owned and operated business, I get to work with my daughters, my son, and I understand what it's like to have caregivers in your home. So as a company, it's so important to me to be able to provide the quality of care that I would like from my own family that we can extend to your family.
I have to assume, is there some type of training that your team goes through?
We do for our caregivers that are coming on, we do only hands-on demonstration teach-backs. Wow. So we don't do the videos, have them watch a video and say, I know how to do this. They have to personally demonstrate to us, and I'm one of the trainers too that teaches body mechanics.
Love that.
Yeah, so except at the end of the day, I get kind of tired, but it's really great because they're taught how to properly use gate belts, transfer, how to break falls, and how just to keep clients safe at home.
And what does the process look like for a new client when you do those first initial assessments?
So it's really nice because we offer our clients the ability to meet us, whether they choose to go with us or not, but we will meet them at their home, meet them in a facility. A lot of the companies we work with, they know that they can call us and bring us in so the clients feel comfortable, because it's really hard for a new client taking on people walking into their home. Right. So if they get to meet the staff first, or at least the owner or the clinicians, we will, we kind of set them at ease, with questions they may have and things of that sort.
Now, what role does the family play?
Oh, huge, because they're an integral part of the whole process. So we get the feedback, we ask them, they tell us a lot of the likes, dislikes, they help us with the care planning, of course, as does the client. Yeah. But they really are they're blended into the whole process.
And not only do you do all of that for seniors and our loved ones, but you also deal with transportation.
Yeah, so that came about kind of as a side note, because as a clinician, when I was in, I saw a lot of our clients getting they get wheeled into a van, the ones that are in wheelchairs, and they're treated like packages. So that's what I felt. Yeah. I was like, you know what? I want to give a white glove through the door experience. So we go through the door, not to the door. So our drivers are all trained, pass certified, and it's a licensed NEMT company called Compassionate Care Transportation.
Wow, and you can just tell the passion that you have for people that are so special in our lives. And people watching right now, they're going, you know what? I want to be part of that family. I want this for my loved ones. What are the first steps they need to take? How do they reach out to your team?
Well, it's really easy. Yeah. They can call our company, which is 614-710-0078, or they can go online at compassionatecaregivershc.com. Fill out an intake form, we'll get notified immediately, and we'll reach out to them. A clinician will reach out to them.
Fantastic. Debbie, thank you so
Thank
much
you
for
so
letting us
much.
come out here. And like she said, if you want to reach out to her and her team, visit their website today. This segment is sponsored by the Central Ohio Area Agency on Aging. The Central Ohio Area Agency on Aging is a nonprofit organization dedicated to improving the quality of life for older adults and individuals with disabilities here in Central Ohio. So here to tell us more is Katie White and Anya Moore Ridley. Good to have you both.
Yeah, thanks for having us.
So tell us what each of you do with COAAA.
Sure, I'm the director.
And I am a part of our caregiver support program.
And talk about what some of your education and outreach efforts are for the Central Ohio community.
Sure, we have education and outreach for a number of topics, but one of the most important ones we want to highlight is our Medicare outreach and education team. So between October 15th and December 7th every year is open enrollment for Medicare, and so we offer a ton of education, one-on-one consultations, really making sure we get individuals connected to their best insurance possible.
And it's perfect timing because this month is National Caregivers Month. Why is that so vital and important to get the word out?
Yeah, absolutely. So with November being National Family Caregivers Month, we want it to be a reminder for caregivers to celebrate themselves. Caregivers should be celebrated all the time, but sometimes they forget. And so November serves as a reminder for them to spend time with their loved ones in different ways and also to get prepared for the holidays as well.
And what are 3 things we and our viewers should know about COAAA's National Caregiver Program?
Yeah, that is one of my favorite things to talk about
Yes.
because that's what I do every day. So one of the fun things that we get to do is we have a caregiver toolbox, which is a guide. We present on 6 different chapters in that guide, whether it's virtual or in person, and just going through the different challenges that caregivers could deal with during this journey. Another thing that we get to do is caregiver consultations, where we spend 30 minutes at a time going over a plan of action with them and their loved ones. And the best part about this program is we get to interact with caregivers across the United States.
Wow.
So if their loved one lives in our 8-county region, we have caregivers that we talk to in New York, in California, in Georgia. But as long as they are reaching out about their loved one that lives in our 8 counties, because we know that the systems here could be much different than the ones in Georgia.
Makes sense.
We are able to spend that time with them and go over resources.
What a network.
Yeah.
And Katie, what other programs and services does your team offer?
COAAA is the federally mandated regional office on aging. So that means we provide advocacy, funding, and services. So in addition to our great education and outreach team, we also provide screening services, assessment services, and in-home case management services. So we are really that hub for Central Ohio for individuals that have questions, needs, for working on policy advocacy, and for making sure people can age in their homes.
Your team covers so much. Where can our viewers and families go that are watching right now go to find out more information?
They can visit our website at coaaa.org or give us a call at 1-800-589-7277.
Katie, Anya, thank you so much for sharing this information with our viewers today.
Thank you.
Like they said, if you want to find out more, the information is right there on your screen, the website, coaaa.org.
And that wraps up today's Senior Living Showcase. Thank you so much for joining us.
We really do hope that you enjoyed learning more about the incredible work being done by many of Central Ohio's local businesses that support and uplift our senior community.
Whether it's providing care, offering transportation, or simply being there as a trusted resource, they are truly making a difference in the lives of so many families.
As we've seen, providing seniors with convenient, compassionate services is not just a business, it's vital to building a caring, connected community. You can always connect with us on Facebook and Instagram. We'd love to hear from you there.
Just search for Good Day Extra. And if you missed any of these segments or want to watch them again, head over to myfox28columbus.com or check out our ABC6 YouTube channel. Just search WSYX ABC6 on the YouTube homepage.
Until next time.
Have a great day.